The biggest issue with colon cancer is it affects everyone equally. It doesn't discriminate against anyone, and the only way to prevent it is to get screened. So no matter what we talk about today, the best goal is pick a screening test you're comfortable with, get that done, and follow through with it. The cause of colon cancer is likely due to a lot of different things. Genetics are possible if you have a family history of either a polyp syndrome or colon cancer, but the vast majority of colon cancers that occur are sporadic. In other words, there's not a genetic risk for it or a family history, it just happens. Early detection for colon cancer is critically important because typically if you're having protracted symptoms, something's already happened. So the goal of prevention is to try to take care of that before anything bad occurs. And without screening, you're not going to know whether or not you've got something that's a precancerous lesion like a polyp or other issues that you need to have addressed. And that's why we've chosen certain time periods in your life. For example, if you're 45 and older, male or female, that's the recommended date and time for people to get screened for colon cancer. The options for colon cancer revolve mainly around stool-based tests and the gold standard, which is a colonoscopy test. The stool-based tests are a way that you can simply use a part of your stool that can be analyzed to look for any changes that would suggest colon cancer or precancerous polyps. So it's really more of a diagnostic test, but we do use it as a screening option. The best and the gold standard is what's called a colonoscopy, and that's where we use a tube that has a light and a camera on it. If you've been sedated and are comfortable, we use that to look throughout your colon, and if you have any polyps, which are precancerous growths in the colon, we actually can remove those, and they don't have a chance to turn anything. So the colonoscopy is not only a diagnostic test, it's also preventative. The stool-based test, if you have one of those and it's positive, then you're going to get referred for a colonoscopy as well. First of all, it's never a pleasant experience to make you evacuate and clear yourself out for a colonoscopy, but it's still not the end of the world either. So it's not too bad, and the colonoscopy test itself is pretty easy on you. Once you get to the center to get your test, we do give you medications to keep you sleepy and comfortable, so you don't remember or feel anything from the test. And afterwards, most people say, when are we going to get started? And we're already done. So they really get through the test comfortably. So I want to, not have people worry about that as much. The risks of the procedure are generally less than 1 in 1,000 of anything occurring. So it's not zero, but it is a very low risk. The prep for the procedure, you're basically on clear liquids, which is anything you can see through for the day before. That includes things like Sprite and Gatorade, soup broth, none of the good stuff in the soup, but just the broth, and things like that. And then we'll give you a medication that will cause you to have multiple bowel movements and evacuate. What we've changed over the past number of years is that we've divided that so you get what's called a split prep now. Take a little bit of it the day before and a little bit of it the morning of the test. That's the medication part. And between that, you drink water-based liquids, whether that's plain water, whether it's Gatorade, iced tea, whatever your choice is, to help augment flushing and clearing your colon. So it's not horrible. We like to make a lot of jokes about it, and that's okay. But it is necessary for us to get a good view of the colon and make sure that we get you an exam that's going to be worth your effort. If we find colon cancer, number one thing to remember is it's not the end of the world. It's a serious bump in the road for sure, but we have lots of ways that we can help treat this and take care of it for you. So if it's early stage disease, sometimes just removing that section of the colon will take care of everything. You don't need any further treatment, such as chemotherapy or radiation or anything like that. It just depends on how far that colon cancer is spread in the lining of the colon, and certainly if it's spread to any other organs in your body, like your liver or something like that. Even if it does that, though, there are therapies to help treat those conditions and try to help get you through that. So average risk patients and people that have average risk for colon cancer, if their colonoscopy is negative, in other words, no polyps or other issues, then the current recommendation is to do this every 10 years. Stool-based tests, if you do stool FIT or stool fit test, that's recommended to do once every year. Cologuard testing, which is a DNA-based stool test, is recommended to do every 3 years for average risk patients.